My name is Dr. Nigel Eccles. I'm the Medical Director of the Chiron Clinic in Harley Street in London. I would like to introduce you to a very exciting technology which I believe will revolutionize the screening of breast cancer. It is important for young women to be thinking about protection of their breast health and also preventing breast cancer. We know that breast cancer has increased by 80% in the last 30 years. What surprises a lot of people is that actually 92% of women who have breast cancer do not have a family history of the disease. And therefore, there must be other causative factors that we need to consider. Breast cancer is increasing in young women, but the screening technology that is currently offered, that is mammography, is only offered to women when they are 50. So how do we fill this gap? How do we protect younger women? The answer is in medical infrared thermal imaging. What is infrared imaging? It is basically using highly sophisticated thermal cameras or infrared detectors to detect heat coming from the body. We know that early cancers generate heat, and this is because there is an increase in metabolism, but also an increase in circulation to nurture the growth of that developing cancer. Both of these things create heat, and it is that heat that gives us the early clues that there may be something abnormal developing in the breast tissue. Hence, we can use infrared imaging to screen for those early changes. This potentially gives us a 6 to 10 year advantage over mammography. The other beauty of infrared imaging is that there is no radiation involved, there is no contact and no compression of the breasts. You can use it in women who have implants in place, you can use it in pregnant women, and most importantly, in my mind, because it doesn't depend on how dense the breast tissues are, and that's the reason, by the way, that young women aren't offered mammograms, because it does not depend on the tissue density, we can use it to screen young women and hence detect these early changes. Now, how young, you may ask? In my opinion, women from 20 years old onward should be having an annual infrared breast scan. What is infrared scanning and how does it work? It doesn't involve any radiation. There is no contact, no compression of the breasts. You can use it in women who have implants. You can use it in women who are pregnant. And the best thing of all, because it is not dependent on the breast tissue density, which is why young women can't be offered mammograms, and I'll explain that briefly in a moment, because it is not dependent on the tissue density, you can use it to screen young women. And how young, you may ask? Well, I would suggest from 20 years old and onwards, a woman should be having an annual infrared scan. Now, just to explain briefly that difference between mammography or mammograms and infrared imaging. With a mammogram, something has to be large enough, and usually about the size of a small grape, before it's big enough to be seen on a mammogram. However, with infrared imaging, because it is not dependent on structure, but on the generation of heat, which happens much earlier in the development of a tumour, it therefore gives us an opportunity to detect these heat changes much sooner than they are big enough to show on a mammogram. And it's estimated that this gives us between a 6 and 10 year advantage. The beauty also is that we can use this to screen young women. So not only can we offer it to younger women and start the screening process earlier, but we're actually potentially detecting the changes sooner as well. And both of these are huge advantages. The equipment that we use is state-of-the-art. It has been especially designed for breast screening. Even the chair has been designed so that women can easily just comfortably hold their arms or have their arms held for the process of the scan, which incidentally takes only about 5 or 6 minutes. The mirrors at the side reflect the sides of the breast so that you don't even need to turn around during the scan, and of course this again saves time. So what happens basically is that the camera will take 100 thermal pictures or more even for the first few seconds, first 30 seconds. Cool air then blows from the machine and cools the breasts, and then there are another 100 thermal pictures taken after that. So we compare before and after this cold challenge, if you like. Now, this is very important because it increases the sensitivity of the test, and not only are we looking for heat changes, but we're looking for how the breast tissue responds to the cooling. An abnormal tissue will respond abnormally to that cooling challenge. In our experience at the Chiron Clinic, there's much that can be done about any early changes that are seen on an infrared scan. So if you're a young woman and we see that there is some early signs of abnormality in your breast tissue, we often find that by just making some simple lifestyle changes, improving diet and nutrition, that these modalities are enough to actually stop any changes, so that when we take scans again 6 months later, they have often gone back to normal again. Now, this is very important because what essentially we are doing is we're taking women who may have been at higher risk and we are putting them on a lower risk platform, and this has got to be worth doing. So in summary, this technology is something that should be available to all women. We all go and see our dentists every 6 months in order to keep our teeth healthy. We are proposing that women should address their breast health in a similar way and think about coming to have a thermal scan annually to make sure that there is nothing abnormal developing in the breast tissue. This truly would change the outcomes that we're seeing in the incidence in breast cancer. It will allow us to detect breast cancer early. It will allow us to detect it earlier in young women, and we are therefore going to be saving breasts and saving lives.